Come in.
Hi, I'm Kara. I'm going to be your nurse today. How are you doing today?
Good, how are you?
I'm good. Can you tell me your name and your date of birth?
Sure, it's Laura, and my date of birth is August 10th, 1992.
Okay. Are you allergic to anything?
No.
I'm going to check this wristband. Okay. Do you know what day it is today?
It's March 2nd, 2020.
Mm-hmm. Do you know about what time it is?
It's almost 9. It is 9.
Do you know where you're at right now?
I'm at the clinic just for a regular wellness visit.
Okay. So, patient is alert and oriented, Tom's 4. She is dressed appropriate for the situation, sitting upright on the bed. She is smiling, seems pleasant, and in a good mood. We're going to start with getting a few vital signs on you. So blood pressure is 120 over 80, heart rate is 80, pulse ox is 99%, temperature is 98.6, and respirations is at 18. Do you have any pain right now?
No.
Oh, okay, well, I'm going to start with just an assessment. We'll try to go head to toe. Okay?
Okay.
All right. First, we're going to start with your head. I'm going to ask you to turn that way. Okay, now this way. Okay, so head is normal, no abnormalities in movement. I'm going to look at your eyes. We're going to shine a little bit of a light in it, and then I'm going to have you watch this, okay?
Okay.
So first, we'll do the left, or your right, and then your left. Now just watch this with just your eyes, don't move your head. Okay, so her pupils are equal, round, reactive to light and accommodation. 3 at rest, 2 at constriction. Her conjunctiva is clear, sclera is white, no drainage, no redness. Now I'm gonna look into your mouth, just say, "Aw." Okay, alright, I'm gonna look in your nose. Okay, all mucous membranes are clear, pink and moist, tongue midline, uvula midline. Okay. Alright, now I'm gonna start with taking a listen to you. I'm gonna do your heart first and then your lungs.
Okay.
Okay, patient had a regular rhythm. S1 and S2 was heard. Aortic, mitral, and tricuspid valve were all present. I'm going to now listen to your lungs, so just take deep breaths as I move. Okay, and go to the back. Okay. respirations were all equal and clear, sorry. No diminished airway, no fluid sounding, unlabored anterior and posteriorly. Now, if you want to lay down, you can. I'm going to listen to your belly. Now I'm just going to push a little bit in each quadrant. Tell me if you feel any pain.
No. 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 Nope.
Okay. And you can sit back up. So she had no tenderness, soft mouth, no tenderness. Abdomen was normal, active, all 4 quadrants. I saw no abnormalities in color, no masses, no scarring, no scratches. I'm now going to assess her strength as well as check her skin as I do so. So first just grab my hands and squeeze them. Okay, now first put your hands up like this. First push against me. Okay, now come towards you. Okay, now you can put your arms like that, yeah. And come in towards yourself. Okay, now outwards. Okay, now I'm going to have you raise your arms like this and I'm going to feel your shoulders. Now try to push up. Okay? And as I do this, I'm looking at her skin and her upper extremities. I'm going to check capillary refill and compare them to both sides. I see no clubbing in her fingernails. Capillary refill is less than 3 seconds. Now I'm going to assess your leg strength. So first you can push up on my hands. Okay, now push down. Okay, now try to raise your legs. Okay, now the other way. Now you're going to try to lift your thigh up. Okay, now try to press it down. Okay, I'm as well going to check capillary refill in the toes, no clubbing or abnormalities, and capillary refill is less than 3 seconds. So all strength, upper and lower, is equal and strong. Now I'm going to assess your pulses. We're going to start on your neck and we'll move our way down. So carotid, radial, brachial, femoral, popliteal, and dorsalis pedis pulses were all equal, strong, and reactive. Now we're going to her assessmentation. Throughout the assessment, she's been able to follow my command with no problem. Doesn't seem to have any impairment in hearing or understanding what I ask her to do. She does have sensation to touch and pain. Throughout the assessment, I saw no abnormalities in skin. I would normally assess in a patient pressure areas and look for any erythema, any wounds, any soreness, any abnormalities. I'd also assess in a woman or male. Breast area, we look for any dimpling, any induration. Have her raise her arms from the hips, put the palms together, and lean forward as well. I haven't noticed any abnormalities if I were to do so on her. Do you have any questions at this time?
No.
Still no pain or anything, any more complaints? Okay. Well, assessment was normal at this time.
I think you did a really thorough assessment. Thank you.